Pediatric scoliosis, or also call it pediatric deformity, is a very, very, very exciting field. It's a very, very exciting practice. The thing that's so amazing about it is that if a patient comes to you with a 50-degree curvature or a 70 or 80-degree congenital stiff rigid scoliosis, and if you're able to achieve an excellent correction, if you're able to correct the spine deformity with a very, very short fusion and preserve motion and function in the rest of the spine, then patients, they can get back to running, they can get back to sports, and they can walk around the office, they can walk around downtown, they can go to school and work, and it's incredibly rewarding. Because if you do a good job correcting the scoliosis, good job correcting the deformity, you can have just incredible impacts on quality of life.